Coming to the second part, which is the examination. And in community medicine, my advice is do not underestimate it. Generally, people tend to see it's a family presentation or a case presentation in the community medicine, and they try to skip or minimize the clinical examination, and which most of the examiners do not like. So let's start. Basically, you have to do the clinical general examination. In general examination, like as always, what you say is patient is conscious, oriented to time, place, and person. Talk about the build. Especially in TB patient, they will be emaciated due to thin. They will be very thin because a lot of protein goes in their sputum and access, and they will be definitely using accessory muscles for respirations because they will be having breathlessness if it is pleural TB or pleural effusion. And also look at any in case of a seizure case, look for any injuries mark or tongue bite. You have to look at the sign of dehydrations, which are like dry skin, dry tongue. And for a child, you have to also do a IMNCI related classification. IMNCI is very, very important for any under 5 or pediatric case, because most of the time your examination will or your case or family presentation will go toward MNCI in under 5K, and they will ask you about the manage classification and management. Look for any skin lesions related to scabies or tinea. As I already told, if it is like even if it is scabies or tinea, if it is a place where overcrowding is there, then diseases like these also spread very rapidly. If there is for oral cavity examination, you can talk about DMF score, which is about how many teeth are decayed, how many teeth are missing, and how many teeth are having filling. So all these things you can talk about or else you can talk about the dental formula, and look at the nails for any ingrowing nails or onychomycosis, which is the fungal infection of the nail. Do the general examination, which is pallor, icterus, cyanosis, clubbing, lymphadenopathy, and edema. Whether there is any febrile to touch or not. If thermometer is there, then measure the temperature. Look at the vitals, BP, blood pressure, respiratory rate, pulse rate. For respiratory rate, you can comment whether there is any use of accessory muscle or not. And or in eye, look for if you have a vision chart, look for the vision in both the eyes, and also if there is any vision improves with pinhole or not, because if it improves with the pinhole, then it mostly relates to the refractive error, not for the cataract. For cataract, the lens there would be lens would be little opaque, and there will be you can look at the color may vary from grayish to white. Anterior chamber depth will be normal except in intumescent type of cataract, and in hypermature and mature cataract, iris shadow will be absent. So these are the just basic finding related to cataract, especially if you are having an elderly case. So that time you have to keep these things in your mind. In exam, these are very common. In exam, they might ask you how to measure blood pressure of the patient, what all sounds will you hear, and how do you say, okay, this is systolic, this diastolic, what are the other ways, how did you look for anemia, how did you examine respiratory rate. So these all basic things will be asked, so be prepared for it. Then, especially in elderly case, they might ask you about whispers test, which is done by standing behind the patient. Keep it 1 arm distance. Ask the patient to close the opposite ear untested by pressing and moving the finger over the tragus. So this is called masking. You're trying to mask it with the other ear is masked, and then exhale first, and then exhale the first breath, and then speak slow a few numbers and letters, and then ask the patient to repeat it. This is kind of a very crude test. These definitely you should carry a tuning fork. Look for Rainey and Weber test if possible to see whether the ear is normal or there is any conductive deafness or any sensory neural hearing loss. So all these things will be taught in ENT. Also, when I'll be discussing, I'll be making one video on ENT examination. During that time, I'll be discussing all these 3 tests in detail. Look, common causes of hearing loss will be earwax or presbycusis. There is also one app called Hear WHO, which can be used for assessing the hearing loss in among elderly. Then let's see how comfortable are they and not. So definitely a whisper test and a tunic fork test you can do for the hearing if you feel your family or case has something related to hearing loss or something related to ear. Anthropometry is must. You cannot skip among children. Especially just one point, especially among elderly, we look for the arm span, not the height, because among the elderly, the spine will bend down and the spacing between the vertebra will also reduce as the people become elderly. So that's why for elderly, we try to assess the arm span. Arm span use only for the elderly, not for the young adults or children. So you have to measure the waist and hip. So most of the time they will ask you, how do you measure waist? Waist is midpoint between lower rib border and the iliac crest. Between this midline, at the midline, you have to measure the waist. It is not at the level of umbilicus. This is what you have to remember. And measurement of central obesity. Measure waist will tell you about a measurement of a central obesity. Hip is the measure as the widest portion of the buttock, and there is something called waist hip ratio. If there is like one of the criteria for metabolic syndrome is waist circumference more than 102 centimeter in men, more than 88 centimeter in women. So all these numbers you have to remember. This will be asked in your vivas. How to calculate BMI? What is the classification of BMI? These are another important questions. How do you measure height or length? This is what they will ask you in the exam, how to measure a weight and all. Generally, you have to remember for Asian population, few years back, this thing came up that we should not use generic BMI for WHO. We should be using specific for the Asian. Generally, Asian have higher body fat compared to the Caucasian with the same BMI level, and also Asian have a slow basal metabolic rate compared to the developed Caucasian. So Asians are more metabolically obese with a normal BMI, but more body fat. So that's why they try to say uh, to use Asian classification for the BMI. But these days, generally, you will see now again WHO global is being used more often. So you have to remember both of the cutoff, and they will ask you what are the formula. How do you measure height and height or length is a very important question. Like one important thing is you have to see is that the head, the shoulder, blades, buttocks, and the calves and heel of the person should be touching the stadiometer. This is very, very important, or the vertical board. And eyes should be straight, and there should shoulder, both the shoulders should be at the same level, and if there is any hairs behind, so hair should be compressed. So these are the very crucial important points to while measuring height or weight, otherwise there will be error. For the weighing scale, you have to definitely look this. There is no zero error. The scale should be on hard surface, even surface. These are very important because all these scales will have 4 points. They all should be at the minimum at the hard surface and all touching to the ground. There should be minimal clothing for the baby or the person for whom you are checking the weight. They should stand in the middle of the weighing scale, not at the corners, and their eyes should be looking straight. They should not be looking at the digital or the weighing scale, because then again there will be some errors. You have to again calculate the height. You have to understand weight for height, which tells you about wasting. If it is less than 2 standard deviation, you have from the WHO's website, you can download the charts. Height for age, it will be for gender wise, for boys and girls, both will have a separate category. Make sure you uh, download the gender specific and age specific. For less than weight for age will tell you about if it is less than 2 standard deviation, will tell you about underweight or not. If it is less than 2 standard deviation, call it standing. If it is less than -3 standard deviation, then we call it as severely stunted. So all these three parameters are very, very important, and how to interpret is you have to remember weight for height, height for age, height for age, weight for age and height for age. And stunting is a sign of chronic malnutrition. This is what you can say. And because height is reducing, so that's why we say there's a, if a child is chronically malnourished, then he'll be stunted. If there is a acute malnutrition, then there will be wasting or underweight. Mid-arm upper circumference, we measure it only for 6 months to 5 years of child. We look at the olecron process and acromion process, and take a midpoint of it. At that level, you measure it. And then again, you have to remember its classification. If it is less than 11.5 centimeter, we classify as severely malnourished. Then examine the respiratory system examination. We'll be talking more detail on RS examination video. But look at the trachea, whether it is midline, whether there is any chest deformity, whether there is any use of accessory muscle, there is intercostal retraction. These are very, very important in under 5 children. Because if this retraction is the intercostal retraction, it talks about any parenchymal disease. Look at any chest movements, whether there's any kyphosis, scoliosis, nipple level, drooping of shoulders or not. Look at the chest expansion, observe and measure how much is the chest expansion. Look at the trachea position, confirmation. Rib overcrowding you can find on COPD, whether there is any tenderness or vocal parameters. Look for breath sounds, any added sound or any area without sound. Percussion you can see resonant or dull. Like this is just one example. For the COPD cases, like there will be less chest expansion, overcrowding of ribs, there will be wheeze and auscultation, there will be use of accessory muscles and respiration, there will be pursed lip breathing, there will be barrel shaped chest, there will be vocal fremitus decrease, wheeze, and there will be hyperresonant percussion, lowerly placed diaphragm, absent cardiac dullness. For cardiovascular, again, you have to look at the inspection, palpation, and auscultation. Abdomen, same inspection, palpation, percussion, and auscultation. For especially in pregnancy, you have to again go through the videos for how to examine obstructive examination for clinical exam. As per that, you have to mention all that things. This is for CNS, mention about gait, neck rigidity, higher mental function, MMSE. Basically, you may not able to do all that, but basically, small part you can try to do, and you can, if you are given only 45 minutes to assess a case, then that time you can not do a CNS examination in that much time and do a family evaluation also. You can directly say, okay, I only look for speech and orientation and the neck rigidity. As others, I could not assess, and the examiners will definitely will agree to it. It also depend which system to give more emphasis. If your case is related to seizure, then definitely you have to do CNS examination in detail and rest in small parts, or just over the brief you can say. If your case is related to TB, definitely if it is respiratory, if it is lung TB, then you have to do respiratory examination in detail. Really, like I told about COPD, you have to do respiratory examination in detail. So make sure you do the related examination, system examination in detail, whatever case you get. There's about the CNS examination. For elderly, you have to, like in the field, you have to do you can read about ACR criteria to diagnose osteoarthritis. This is the ACR diagnosis criteria to diagnose rheumatic arthritis. So all these things you can look the foot at the foot, whether there is any wound or ulcer. In case of diabetes, like, or else if any other symptom is related to gout, that also you have to keep in mind. Detail of the other family members you have to mention. If any other family members in doing the history, if you have mentioned about their complaint, then mention about their examination finding. Now comes the very, very important part, because when after the history, most of the examiner can tell you to skip or tell you only the relevant examination finding and come to the family diagnosis. If they're too much in hurry, then most of the examiner might even tell you, they may not even listen to your history or examination. They will directly tell you, okay, tell me the family diagnosis or the case diagnosis. Then you have to, in the diagnosis, you should have a physical, psychosocial, nutritional, or environmental, all the problems. Even you can even add spiritual to it, or even if it is a family thing, financial thing, that also you can try to add and give it one diagnosis. It should include details of index case, type of family, index case disease, and its status, like especially if it is diabetes or hypertension, whether it is controlled or not, whether it is seizure disorder, whether it is controlled or not, any problem of family related to medical, non-medical, any stress, You have to mention whether it is their whether if there is any couple protected by contraception or not, whether there is any other vulnerable group in the family under 5 adolescent. That thing you have to mention. I'll give you one example. So this is one example. This is a Hindu nuclear family of 4 members belonging to upper lower socioeconomic status, come as per the Kupuswamy modified Kupuswamy scale, in which the index case is diagnosed with uncontrolled generalized seizure disorder, currently on medication with special diet, like you if the person is taking Keaton's diet or Atkins diet, you can mention something related to that if it is if the patient is taking with normal in the examination finding and intact cognition. His nutrition status is normal and fully immunized. There is one eligible couple in the family protected by contraception. There is one more child, more than 5 year old. He's also immunized, attending school and having adequate nutrition. Other family members are apparently healthy. The parents are stressed about the families, about the child's uncontrolled seizure disorder and having a debt of 20,000 rupees. So this gives a very comprehensive diagnosis about the family, gives an idea about um, the financial status, gives about the disease disorder, gives about the any stressor in the family, about other family details. So like this, you have to give the complete diagnosis. You have to practice it, and with practice, it will come much better. Before the exam, you can make these types of family diagnosis and discuss with your JRSR or even with your batchmates and try to modify and improve it. Then at my college, what we are taught is that you can refer to this paper written by Dr. Anand Krishnan, Premadhav Behra, and Dr. Berry Dallin. So in this, what we try to do is, like, this is a case of TB. We try to make a web of causation in which the disease is at the center of the web, and it helps us to, okay, where all we can do intervention. Like in this, what we try to do is we make a short we point the risk factors which are modifiable and which are not modifiable. Like a person was chronic smoker, that's why he got COPD, and again he became a risk factor for a tuberculosis. Like this, like here we can see patient was a recently migrated, he did not have any BPL card, no support, and he was not availing any pension, and no financial support. He did not have any health insurance. That's why he had a catastrophic expenditure. So we are trying to identify what all problems, like he had a poor dietary intake and then had a severe undernutrition, again prone for tuberculosis. So what all are the risk factors which led to the disease? That thing we are looking at. And this disease can be controlled by if what all things he do. So that is called web of this is called progressive factors. What all, like how the disease will progress if he's not having compliance, what all outcome will happen uncontrolled. So you can try to make some web, like if the person was elderly female, so and they was unemployed, so they have financial problem, and due to financial problem they reduced their diet intake and they became underweight and became risk factor for TB. So all these risk factors we want to identify, and then among these risk factors we will identify which can be intervened by you or by your team. So this is very, very important. We try to give also equal marks for the intervention, for the for the history presentation, for the examination, for the family diagnosis and web of progression, and then intervention. This assesses actually what all benefit happened to patient by your visit, because patient should also get something in return, because he's helping you to learn, he's letting you to come and learn from their family and let you visit them at the house. So basically these intervention can be categorized as late or immediate based on the need and the priority. This table you can make, like at the individual level, what all intervention did you do? You did a medical or non-medical? Then at the family level for the other family members, then at the community level. Medical intervention would be related to advices related to investigation, treatment, follow-up, or a referral to higher center. Non-pharmacological could be like you can appreciate their good practices. You can give some dietary intervention related to diet or protein intake or salt intake. And then it could be related to physical activity, counseling, explaining danger signs, or monitoring of the disease, or physiotherapy. Social interventions could be related by you may help them contact with medical social officer, or connecting them with social scheme, rehabilitation facilities, or increasing the access to government health facilities, connecting with the NGOs. So all these will be related to social intervention. Like this is just one example, for especially related to the advice for the hypertension related. You can tell about high salt and food, like they have to limit the salt intake to less than 5 grams, and then itself is a very very tricky intervention. All the intervention has to be customized. You have to understand, it has to be tailor made for each person. You cannot give generic advice to everybody. They have to decrease the oil, how to do it, and all these things you have to mention. For old age, you can talk about concepts of healthy aging or active aging to strengthen their muscles to avoid falls. So all these are part of your intervention. Like you can even for a medical from a medical perspective, like you can help them to get an appointment and get them consultation. You can even help them to get a teleconsultation. That itself is also one form of intervention. Try to go and help the people in the community. Dietary intervention, always try to consult with the senior person there, because diet has to be affordable. You cannot tell a person belonging to lower socioeconomic status to have avocado or to have dragon fruit. These are very fancy and costly fruits. It has to be culturally acceptable and less costly. You can do because are you doing a diet replacement or you're doing a diet modification? Are you changing their habit? And changing habit itself is a big thing. It takes time. So we have to understand, we have to be very very careful while the dietary interventions are done. Diet in elderly and children should be according to the dentition. If they do not have the teeth, you cannot tell them to have something like to have jaggery or to have peanuts, because these are very difficult to have it without the teeth. And to diet for the children should be mostly with the sweet, because salt might be harmful for the children for of child of less than 2 years. They can try to have jaggery, gajak. So here now I want to give you some tips for the field. Uh, One is that your visit should be helping the family or the case. Try to educate the family, give them some guidance, give help them, link them with some NGO schemes or your hospital. Have a good rapport building with the family in the initially. Do not start penning down everything, because then you will lose the contact. And test your this is a very good opportunity to test your communication skill is one of the important skill which every person must have, irrespective of their occupation. This can be considered as one of your life skill. Most of the doctors are very good physicians or surgeons, but they are not able to communicate to the patient, and if they lack there, then it causes a lot of problems to the patient also, and even to doctors. To don't be a stenographer to note down everything. Give a empathetic listening to them. Listen to their problems. They will tell you the whole story and nicely. Observe each and everything, but do not judge it. So important questions during the Viva, which you have to always prepare, is have a detailed, thorough reading of the risk factors, about the diagnosis, about the management, about the preventive and rehabilitative part of the disease. You have to read the full disease of the case in detail. List out the interventions, medical, non-medical, at the family level, at the individual level, at the community level. Health programs related pro all the health programs and health schemes you have to read. Go and know about their local health facilities, private and public, which are nearby that about that family. Now I'll tell you about what are the minimum requirement of a case or a family whenever you present a particular case or a family. So what all minimally you should try to put it there, like all these, like in case of a pregnant woman, you should never miss about menstrual history, obstetric history, detail of previous pregnancies, risk factors, whether the family whether there is any abnormal weight gain, mention about iron intake, adherence to iron, TT injection, any ultrasound, blood investigations, dietary intake is very very important. Diet history is important in pregnant women. Antenatal visit, talk about birth preparedness and complication readiness. I already told about that. Know about the high risk assessment. These are very very important. Like you should do the high risk pregnancy screening. If any of this feature is there, then you can say this is a high risk pregnancy, and high risk pregnancy need special follow up and higher number of follow up, and it needs a more care compared to the normal pregnancy. So make sure you do all the screening that the so for a diabetes or hypertension case, you must read about how to diagnose this, what is the diagnostic criteria, what is the how to follow up them, what is the how to titrate the medication doses. You can, if you're not, if as an MBBS student you are not able to understand what all medication they are taking, you can just click the photos of it and can discuss it later on. Patient is taking this drug and that drug at what time. Know about the disease status, monitoring and timely refill, knowledge attitude practice, diet and physical activity, because lifestyle is will consider an important part, especially in non-communicable diseases. You have look at the follow-up annual checkup, like how frequently they're supposed to look at their LFT, yeah, their liver function test, renal function test, their how frequently they are supposed to do their eye fundus examination, their foot examination they're supposed to do. For a diabetes, remember to look for cataract examination, foot examination. Self-care is very very important. This is a very highly uh, self-care among diabetes or especially non-communicable diseases are very very important. Read about it, what it is, how it is to be done. This is just a gist I'm trying to give you, like for history of presenting illness for diabetes and hypertension, but all you should try to put, like what are the symptoms, what how it was diagnosed, initial treatment, relieving symptoms, change of practitioner was done or not, how is the course over the years, whether it's control or not, what are the symptom of is there any symptom of uncontrolled diabetes or hypertension, when did they last tested for blood pressure or blood sugar, any complications. These are the list of complications, especially for case of diabetes, whether there is any complication. So all this through history you can ask. This is for an under 5 child. For under 5 child or any malnourished child, you should know about any nutrition deficiencies in the child, like flaky and blonde thin hair. And these are the specific, like for vitamin A, you can look for bite out spot, which are seen on conjunctiva and on the lateral side. Is there any night blindness or there is history of hitting the objects of wall or any xerophthalmia? For vitamin D, any bowing of leg or pigeon chest? For vitamin C, any bleeding gum or beads or rosary beads on the chest? With this, you will see on the X-ray also. Vitamin B or folic acid will deficiency will cause oral ulcer, cheilitis, or fissured tongue. Iron will cause anemia or cholinergia. So all these things you can assess. Growth charts are very very important. Try to have a growth chart with the previous old reading, and they should have the mark. So as per, so you can give a better reading to the growth chart. Look at the feeding and exclusive breastfeeding, bottle feeding practices. Is there, is not, how the weaning was done. Look for the positioning attach. This I already told. For the breastfeeding, you have to assess it. In the diet history I have mentioned it, but in the examination also you have to see how is the positioning of the baby, whether there is a sign of good attachment or not. In the history you have to assess, as a part of history, whether this child feeding is adequate or not. Vaccination or immunization, you have to assess for the uh, any child case. Look for the antenatal history, intranatal history, neonatal history. So these are very important. Where the baby was delivered, was there any complication, what was the birth weight, delivery type, cry at birth or not, whether there was any ICU admission or not. Then anthropometry again, and then classification. IMNCA related, you have to read. Wash scores, you have to mention. There is also a scale for wash scores, how to calculate it. I'll try to put it in the performer given below. You can look at the description. Milestones and dentition, you have to check, and you have to also look at the assess for any accident or hazard points at the house, any special or tradition or cultural related practices. In case of a patient with TB, you have to look for any external marker of tuberculosis, BCG vaccine mark. Remember, vaccine mark is sign of vaccination but not immunization. Immunization means has been antibody formed. If there has been antibody formed, means the person is immunized. Vaccine is just giving an injection. Giving a injection is called vaccination. Then they will ask you how is the efficacy of vaccine, BCG vaccine for generally for lung TB, BCG vaccine protect from 0 to 70%. For disseminated TB, miliary TB, it protects up to 95 to 99%. So this is higher efficacy for disseminated TB and less for lung TB or your TB lymph nodes. How to collect the sputum for among a TB patient, for a TB patient is very important. How to dispose of the sputum for what are the practices followed by the TB patient, these you have to assess, and if not you have to teach how, what is the adherence. You can do the pill counting and you can see if there is any side effects, how is the weight gain, how is the follow-up being done, whether they have been TB patient need to be follow up for a drug sensitive patient separately and a drug resistant separately. You have to read the full program and TEP in detail, read about the social schemes and do mention about them. For an adolescent patient, there's an acronym which is very commonly used. US is the home, US is the education, US is the eating habit, S is the activities and employment status, whether any drug abuse, safety, sexuality, and sex. So these are the head. For female, do mention about menstrual hygiene, menstrual history, schooling. You have to look violence or any substance abuse. Look at nutrition. For general health or depression, you can use PHQ-9. For elderly, there are a lot of acronyms. They will might ask you. There's 5 geriatric giants like immobility, instability, incontinence, continence, impaired intellectual or memory impairment. This is what you can assess, or you can assess for 4 or for eyes or for 4Ds. There are generally a lot of scales. One of the important scales for elderly what we always try to assess is Barthel or index. These are very, very important. IADL, activities of daily living. These scores are always asked how mobile adult how mobile is this geriatric person is very important. So and among the geriatric population, depression is also quite common. So this geriatric depression scale can be also used for a CVD risk chart. Now not IS chart but CVD risk chart is available. You have this chart, you have to also assess the CVD risk for any NCD patient, like patient with diabetes or hypertension, and also among elderly to try to assess the CVD risk. What is their BP? What are the, based on laboratory or non-laboratory, you have to download it from the WHO website. Extra is look at their denture because it will affect their nutrition. Look at, these are the sign of elderly, xanthelasma, nothing much. But there is vaccination specific to elderly. That thing you can read. You can read about age-friendly house and bathroom. So all this hearing and vision problem, these things we have to assess among the elderly patients. So this is just one scale, comprehensive geriatric assessment scale. So you can use this scale if there is a geriatric case, depends on you. For epilepsy, you can just same again look at the etiology, how it started, how it is controlled and uncontrolled, or there is any advocacy of treatment or not, any follow-up, when was the last seizure done, how is the follow-up being done. So in the end, again, I would like to promote my book. For undergraduate, there is this book, list of important questions. These all three are mainly related to PGs, and they have a detailed short notes, long notes. It has basic concepts, important tables and numbers, and they already have list of important questions to read for exam with answers. So you can go and see in the Kindle. Most of the time I get this request that on phone it is very difficult to read. Basically, you can download this Kindle app on your laptop or your tablet or iPad, and then read it in the bigger screen. This is what the solution is right now. And for more, you can subscribe to my channel and can even give my their feedback about this video. See you guys in the next video. Tata, bye bye.